Tonight, allegations of discrimination at some of the highest levels inside of one of California's largest hospital systems.
Yeah, a longtime physician says he lost out on promotions and that he was the target of pay cuts and insults, all because he's black. Senior investigative reporter Bigad Shaban has that story.
As a pediatric eye surgeon, Dr. Omandi Nyong'o has helped heal thousands of children from complex and sometimes life-threatening diseases. But during his 14 years at Sutter Health in Palo Alto, he says he diagnosed something so dangerous, so pervasive, that it's even threatening certain doctors, including himself.
I was exposed to the type of racism that hits you on the back of the head when you don't see it coming.
Dr. Nyong'o says discrimination at his workplace made him the target of racially derogatory remarks, demotions, and salary cuts. He says his supervisor even asked him not to use the elevator at his clinic and instead use the stairs to avoid running into white colleagues who felt uncomfortable seeing him. Dr. Nyong'o has been repeatedly recognized for providing high-quality patient care, even by Sutter's own health system, but says he has been treated poorly because he's a doctor who happens to be black.
There are not many of us to begin with, but of those, many of us have either experienced the things that I have while at Sutter or have been chased away over the years.
Dr. Nyong'o's allegations are now part of a lawsuit he has filed against Sutter Health and its Palo Alto affiliates. The suit includes accounts from Dr. Nyong'o and 7 other anonymous black doctors. The long list of accusations include race discrimination and retaliation. The lawsuit also claims Sutter's workplace culture disrespects, undermines, and disciplines African-American staff and doctors.
When I asked these leaders to please stop this pattern of racial scapegoating, instead of protecting me, they doubled down and labeled me an angry black doctor.
When you raise these issues, you then feel like you were retaliated against?
I was disregarded and then disciplined for them, and instead of investigating my complaints, they turned us into the problem for raising those HR complaints.
How long did this go on?
Too long. It's been going on for a long time, and it still goes on.
Sutter, in court filings, has denied any wrongdoing, and in a statement told us, "We are committed to fostering a diverse and inclusive workforce, as well as a healthcare environment where all are treated equitably, with dignity and respect, and provided the opportunity to reach their full potential. As a healthcare system serving diverse people and communities, we do not tolerate discrimination of any kind."
If it could happen to Dr. Nyong'o, it really could happen to any doctor, any black doctor.
Kelly Dermody is Dr. Nyong'o's attorney.
You're claiming racism at some of the highest levels at one of the largest medical institutions in California.
Yeah, it's really just stunning when you say it. That shouldn't be happening. And you'd like to think that racism only exists in this cave decades ago, and we can kind of put it in its box. And unfortunately, that's just not the way it is.
You're an experienced doctor. That is not up for debate. But you're saying Sutter treated you poorly, all because you're black.
The fact of my blackness and others has been used against us to justify poor treatment. They placed me on a performance improvement plan after I complained about unfair treatment as a black doctor.
According to Dr. Nyong'o's lawsuit, while at Sutter Health, he was ordered to carry out a hospital restructuring plan that his bosses came up with that would have required certain doctors be transferred to different locations. But when those physicians voiced opposition, the plan was tossed. Dr. Nyong'o says he was forced to take the fall. His leadership title of medical director was stripped and his pay cut by 40%.
What did you take away from that?
A black doctor like me is expendable. We're used as tokens.
What happened to the 2 doctors who happened to be white who did come up with that plan?
They continued in their jobs, yeah.
Were they ever demoted or penalized in any way?
Not that I'm aware of.
Sutter's attorneys say any negative employment action against Dr. Nyong'o was due to legitimate non-discriminatory and non-retaliatory business reasons.
Sutter has said it was your attitude at work that led to your demotion, not the color of your skin.
Characterizing me as being angry or intimidating as a black man, these are very thinly veiled, racially denigrating insults in order to disguise their true motive, which was to prevent me from speaking out against my poor treatment that those same leaders had subjected me to.
Sutter Health is one of California's largest medical systems, with more than 20 hospitals, 53,000 employees, and 3 million patients. But according to the lawsuit, there are no black leaders within Sutter's senior ranks. And of the 354 physicians with some kind of leadership position within Sutter, only 3 are black. Sutter would neither confirm nor deny the accuracy of those figures. We also requested similar racial demographics from other large health systems, Stanford, UCSF, and Kaiser, but none would provide us with their data.
I personally can't see problems of this magnitude and do nothing about it.
To advocate for black physicians nationwide, Dr. Vanessa Grubbs of Oakland founded Black Doc Village, a nonprofit that aims to help doctors and med students overcome discrimination at hospitals and clinics.
We are systematically undervaluing an entire group of people based upon these delusions that somehow black people are less than.
Dr. Grubbs has been practicing medicine for more than 20 years and says she's seen discrimination force black doctors out of the medical profession before their careers even began. She says it happens right after med school during their required residency training. Black surgical residents are kicked out of those programs or quit at nearly 2 times the rate of other residents. And that's meant fewer black doctors across America. Just 6% of physicians are black, even though black people make up 14% of the U.S. population.
It's about so much more than these individual careers. What is really at stake is the fact that black people in this country are dying disproportionately across all outcomes. And we know that black people get better health outcomes when they have black doctors. We know that they prefer black doctors, but yet have reported that it's really hard to find a black doctor.
Dr. Omandi Nyango says he won't abandon his patients. He continues to practice at Sutter, but tells us it's unconscionable for a medical system to let something so harmful go untreated.
I didn't create the racism. They did. I called it out so that it can be dealt with. Not a comfortable thing to do. If doctors don't stand up against racial bias, then who will?
As is typical, Dr. Nyango gave a deposition where Sutter's attorneys questioned him about his claims. But what was unusual, according to legal experts, is that Sutter summoned 2 of Dr. Nyango's bosses to sit in on the process, face to face, as Dr. Nyango recounted how those very supervisors allegedly discriminated against him based on the color of his skin. Now, unless both sides come to a settlement, the case is expected to go to trial this summer. With the investigative unit, I'm Bigad Shaban.
If you have a story for our investigative unit, call 888-996-TIPS or visit our website, NBCBayArea.com/investigations.